Hello, good evening. Dr. Hashmi here. I'm just a psychiatrist. Wednesday evenings, I have set aside an hour to talk about core mental health disorders. Today, I'm going to talk about the most commonest disorder, depression or depressive disorder. Even the most common disorders, there is a lot of misunderstanding amongst everybody. Hence, it is relevant to talk about it. In England, according to the Mind, which is a significant charity, 8 out of 10 people, 8 out of 100 people, 8 out of 100 people suffer with depressive disorder. According to NHS England, 1 in 6, which is a very, very significant figure, individuals experience some kind of mental health symptoms, and the risk we carry is 1 out of 4. So I will not be surprised if you know quite a few people around you who carry the diagnosis of depressive disorder or prescribed antidepressants. 8 out of 100 only in England. In the world, I believe, and I truly believe, that the percentage is far higher, because there are countries and parts of the world where mental health is not as recognized as in England. Secondly, when people have bigger responsibilities, it is very hard for them to even recognize major mental health disorders, in sense that in parts of the world where people's basic life is challenged on a daily basis, there are other parts of the world where people, if don't work non-stop, they won't get any food. We live in a world which is not balanced in some ways. The resources are not evenly distributed. So, in those parts of the world, the prevalence of depression might well be far higher than England. But it is 8 out of 100, 8%. One can presume it might go up to 10 to 15% if you look at the whole world population in that context and give some percentage to the undiagnosed depressive disorder. So this is the starting point. It is the most important and significant condition of mind. Now, there's another issue. Quite often we hear that antidepressants have not made anyone better. Or I have been taking antidepressants for 5 years and I have not felt any better. Now, this is something which I want to discuss as well. Medication is designed to do its job. Antidepressants are effective drugs, clinically proven to be effective. No drug could ever be licensed to be prescribed unless it is proved by robust research studies that it is an effective drug. So why there are so much confusion about antidepressants, and there are scores of people who are taking this medication for years to end but have not felt any better. Now, the first issue is, if someone is diagnosed with depression, the individual should get better with antidepressants. It's as simple as it is. If not getting better, we need to look beyond depression. What I have learned in my career is, if you make a diagnosis of any mental disorder and you start treating that disorder, and if you see the clinical improvement is not satisfactory, not as per your expectation as a clinician, you take a step back, reassess the situation, and review your diagnosis. Must have a fresh look at the diagnosis and the whole clinical presentation, because you might be missing something. So this is the first step. Number 2, there is a lot of impulsive diagnosis as well. It is not uncommon to get a prescription of an antidepressant after just a very short conversation with your doctor. Maybe 5-10 minutes conversation. In these circumstances, if depression is not properly assessed and formally and properly diagnosed on clinical grounds, antidepressants will carry a very, very little role in bringing clinical improvement. So the diagnosis of depression is important, and the diagnosis must be backed up by a robust assessment. So let's go through the symptoms one is likely to experience as a result of suffering from depressive disorder. Mind you, there is a difference between formal diagnosis of depressive disorder and many other similar emotional and mood experiences. For example, have you ever heard anybody being diagnosed with an adjustment disorder which presents very, very similar to depressive disorder, but will unlikely to respond to antidepressants because it's an entirely different kettle of fish? Yeah. Now, reaction to stress, grief reaction, bereavement reaction, job loss, human normal experiences. To diagnose someone with a mental disorder, you must keep in mind a very basic principle. And that principle is it a normal reaction to a challenging situation, or is it an exaggerated reaction to a normal situation? Now, we go through life events. Life is full of events. Life throws challenges on you. Sometimes we enjoy prosperity. At other times, we struggle with finances. Life, even the best life events, the research studies carried out on life events and the impact on it, the life events we believe are the best and associated with the top end happiness and contentment are also related to stress. For example, if we scale, and I'm not saying that, this is based on the research studies being carried out. And I want to make it simple. That is why the conversation is very simple and straightforward. If we rate life events from 0 to 100 on a scale of stress, marriage is just bang in the middle, 50. The score of 50 is associated with marriage in terms of stress, job loss, house change, birth of a newborn, birth of a child, anything which changes our environment, because inherently we do not like change. Even if we claim being the most appreciative individuals for a change, ready to embrace change, still inherently we like to stick to our routines. We like to keep things the way they are. Hence, the change in circumstances is likely to bring stress. Then we lose our loved ones. Nobody in life can say they have never lost any loved one. We all have lost our loved ones. That is the way world works. So what does it bring to us? Grief, sorrow, loss, a bereavement reaction. Now, these human experiences are very normal. We are bound to feel low. There are days when we are bound to feel desperate. There are days when we bound to feel terrible. Sometimes we just wake up at the wrong side of the bed. And the whole day we spent being irritated by every possible thing in the world. That's life. So if we start rushing around looking at every human experience as a mental disorder, would not be a healthy attitude towards life. You must bear in mind that human psychological processes are brilliantly designed for self-recovery. We do recover from grief, loss, sorrow naturally. In every culture, in every society, in every faith, there are centuries old systems, processes, and mechanisms are in place to help and support people going through grief and bereavement and to get them out at the other end. And those mechanisms carry inbuilt therapeutic quality and value. So that is not depression. Reaction to an unfavorable situation or job loss or house move, if it gives you a phase of emotional stress, is not depression. Can anybody tell me even a brief period in their life they have spent without stress? It is a constant expense of our psychological resources. I have written a book called Psychorupsy. Psychorupsy is worse than bankruptcy. And I have compared the domestic budget with the psychological budget. How to budget your psychological resources. And constant stress, which is normal, healthy, and we cannot do anything about, it got to be there, is a kind of a constant expense of our psychological resources. Now, this is not depression. The way I see it is depression, if assessed and diagnosed correctly, robustly, properly, and treated properly, it is a fully treatable condition. People recover and get on with their lives. And that's the way it is. Now, what do you need about it? What do you feel and experience when you call it depression? The first thing you need to bear in mind is your biological functions. My understanding of depression might not be similar to many, but I will try to explain depression in a way, in an organized manner, so you could actually feel what is depression. Because you cannot tick box these things. Mental health is not a tick box exercise. You got to understand an individual. You got to see an individual's life from their eyes, and then you understand what's happening in their minds. Now, the first thing I was saying, biological functions. And what are the main biological functions. Sleep, appetite. These are the two main things. Now, if there is no knock at your door, would you ever know that somebody is standing outside waiting for you to open the door? Most certainly not. Would you expect someone to come and stand at your door, wanted to see you, and just not knock at the door or not to press the call bell? Doesn't happen like this. If someone wants to come to see me, they have to either press the call bell or knock at the door. Just use this analogy for biological functions. If you are sleeping right, if you are eating fine, if there is no change in your sleep and appetite, you are healthy. Your mind is healthy. This is the first thing. Now, I have used the word change because we all have different level of biological needs. Some people like to sleep for at least 8 hours, 10 hours. Some people like to sleep 4 hours. I have hardly slept for 5 hours in my whole life. 4 hours sleep works for me perfectly well. 5 hours is oversleeping. Some people sleep less, some people sleep more. This is our biological setting, natural setting, with our own sleep-wake cycle systems. If your sleep is comfortable, if there is no change in your sleep, if you are waking up fresh, looking forward to the day, that's fine. You are a healthy sleeper, even if you need 4 hours sleep, or if you need 5 hours sleep, or if you need 10 hours sleep. It all depends on your biological functions, biological setting, natural setting, default setting. What we call it company setting, the settings we are born with. It's very hard to go against them. If there is a change in it, and when we are talking about sleep, we need to look at it from the quality point of view. The first thing about sleep is when we go to bed, how long we take to fall into sleep. If there is a delay, it is called initial insomnia. Now, that period of sleep between us going to bed and falling into sleep is crucial. And I need to talk about it as well. Now, the reason I'm going into detail and sometimes a bit tangent, because if it takes longer than an hour, that's fine. This time is set aside to talk about depression. And if the viewers get benefit out of this conversation and it improves the quality of their mental health and their life, that is the point. That is the aim. Now, that window when we go to bed and fall into sleep usually is about 10-15 minutes. Sometimes it's half an hour, but it's a very crucial window. The reason is that in some situations, the mind goes out of control during that initial phase. And instead of us falling into sleep, the mind triggers a system other way around. So we end in spending 2 hours lying in bed not falling into sleep. Some people fall into sleep like this. Some people take a bit longer, but within reason. If you are having any issues with initial insomnia and you are struggling to fall into sleep, I tell you a simple gadget to use. And I have no personal interest, no personal investments. I have no other reason to talk about these gadgets in my conversations except for clinical benefit. Because over the years I have used them, I have recommended these gadgets, and these gadgets have benefited many of people who have come and talked to me about their issues, yeah, or asked for my assistance. Search for amber glasses for sleep. AMBER. Amber glasses for sleep. If you search on Amazon, plenty are there. Just buy the cheapest and the darkest and start wearing them for half an hour before bedtime and continue to wear them for 6 to 8 weeks. Your sleep will be fine. Sleep is a big issue. What these amber glasses do, they block blue light, and the moment the blue light is blocked using amber glasses, the pineal gland in brain gets activated and starts secreting a hormone called melatonin, natural melatonin. Now melatonin needs to be secreted at certain point in certain quantity to make us fall into sleep. And these amber glasses gives you the power to regulate your pineal gland, teach your pineal gland to secrete that much of melatonin at this specific time when you want to go to bed. You will see your sleep-wake cycle is regularized, stabilized in no time. They are all benefits of use of amber glasses, but the downside is that if you are within the age group of, let's say, 70 plus, then don't wear them for half an hour. Wear them for 5-10 minutes, because half an hour use of amber glasses, if you, during the age bracket 70 years plus, can make you dizzy. That's the only downside which I have come across over all these years I've been recommending them. Yeah. Now a gentleman has asked me, somebody has asked me, actually I won't know whether a gentleman or a lady, doctor, can I have mental health questions? Yes, please, go ahead. Please ask questions. That will make the conversation far more exciting. We have all the time in the world. Now, so that will, you will overcome initial insomnia by doing that. There is another important aspect of this time when we go to bed and fall into sleep, which I'm going to take it into my conversations which I'm holding on neurodiversity, ADHD and ASD, which I'm expert in, because I will talk about the therapeutic element of it during my conversations in neurodiversity. But for the time being, use amber glasses for half an hour before bedtime. Buy the cheapest and the darkest. I have no personal interest in any form, shape or size in these gadgets I'm going to recommend. During my conversations, I've just found them clinically beneficial, and they don't carry any side effects. Yes, if you are 70 years plus, use it for a shorter period because half an hour might make you dizzy. Apart from that, you can use them. Yeah, very good product for sleep and appetite. It's for sleep organization. Coming to appetite, if you are eating the same quantity as you have always done, along with your interest in food is maintained, that's fine. Because when it comes to food, we pick food on four basic things, and I have said it before. Either the food looks brilliant, the physical appearance of food, or it smells fantastic, wonderful, and it works as an appetizer, or it tastes marvelous, or how the food feels like in our mouth. And that is the four things. If you look at your own likings of the food, you might be a person who would go for a food which smells very nice, or somebody would go for the way food taste taste nice or feels inside the mouth. Yeah. Now, just read this question and then I'm going to answer it. Today I bought a knife and angry at the boarding house in front of my house because they were singing loudly at 1 a.m. Do I have anger issues? Am I wrong? I just want my family to not wake up to them every night. Now, I don't know which part of the world you live in, but I think buying a knife with an intention of using it is a law everywhere in the world. It is not. It's a crime everywhere in the world. So of course, that is something which I presume someone with anger issue would do. Yeah. Now, yes, you. It sounds like that you may have issues, but on the other hand, if you look at it, the boarding house residents needs to act within reason. Now, this boarding house must be run by an organization. There must be somebody who manages the house. Why not to involve him into conversation or her into conversation and talk to them? And then I presume your house might not be the only house in front of the boarding house. There must be several houses around there, and if your family, your children, your wife cannot sleep properly at night just because of the boarding house party environment every night until 1 o'clock, of course other houses and other residents would be having the same issues. My suggestion would be that engage your neighbors first and make a kind of a group of people living around and affected by the behavior of the residents of the boarding house, and then approach the boarding house management committee or the manager and express yourself in a collective fashion. The benefit is you might be a bit angry and you might have an anger issues, but on the other hand, if you look at it, the most risky issue I see here is you acting on your own. If you involve other people, engage other people, and act as a collective group, number one, you are all going to balance each other's out. Yeah? And then you will be able to identify someone who could actually talk to the management of the boarding house on everyone's behalf, in everyone's presence. And I think that will carry a better impact. Um, Instead of you acting alone, because it will place you at a very risky situation. Um, and then, in any event, if you take any action, um, uh, you will probably the one suffering out of your action. Now, the further question, the boarding house is owned by an individual. 2 years ago, I was invited to fight with the owner, and the owner even defended them while threatening me with a knife. The neighbors agreed with me but did not dare to speak up. So it looks like some kind of aggression going on from that side. Can Are you in a position to involve law enforcing authorities? You know, mean the thing is, your neighbors didn't have the ability to stand with you at the moment. They are a bit afraid of that guy. Um, you are a strong person, and you feel that I'm responsible. I should take responsibility and put these things right. The individual you are dealing with, you can't negotiate with them. I don't know the level of law enforcing authorities, the way they work in in the country where you live. Um, Law enforcing authorities are not always efficient in every part of the world. We take that on board. Um, if you look at yourself and your family, is there a possibility that you move elsewhere, you sell this house, buy another one, or move elsewhere? Because the thing is, what I feel is that if the environment is like this and nobody is doing anything and you are getting wound up with the situation, is there a possibility where you just focus on yourself and your family and your children? Because in any event of expressing aggression, uh, and you end in picking up the bill or the consequences of the actions, the downside is that your family, your children, your wife, all the family will suffer as well. So sometimes uh, anger um, uh, could lead to serious consequences and regret afterwards. My suggestion would be that look at the alternatives. If you are cornered and you feel that you are cornered and nobody is there to help and support you, then look at other alternatives. The priority in all events, always take a step back and think, what is my priority? Now, my priority is me, my family, my children. These are my priorities. Now, I give an example which might make my conversation a bit more clear. If you are traveling in an aeroplane and the oxygen level goes down, what is the advice given by the airline or the pilot? They always say that if the oxygen level will go down, an oxygen mask will drop in front of you. You must put the oxygen mask on yourself first, then start to help other people. Even if you are traveling with small children, babies, you got to put the oxygen mask on yourself. Because if your oxygen goes down, you won't be able to help anybody. So you, even to help your most loved ones, your oxygen level needs to be right. Now translate this example into many things in life. Many things in life. In situations like these, man, you got to put an oxygen mask on yourself. Protect yourself, and that protection will be your family's protection. Find an alternative, because the situation you have presented me with, it doesn't appear that you have much of a choice except to move elsewhere and leave this behind. It doesn't appear that you have anger issues as a primary situation. I think he has probably pushed you to a stage, leaving you with no option. And anybody who is cornered with no options going to react. Yeah. So I would suggest is take a deep breath, value yourself and your family, and if you have to do a compromise, sometimes compromises are far better than regret afterwards. That will be my view and advice on this. Yeah. Now, with appetite, coming back to the topic of our depression, appetite. When you talk about appetite, you got to look at the quality of your relationship with food. Now, I'm going to talk about this further in neurodiversity, because that's where food become more significant. But excluding the autism and ADHD, under ordinary circumstances, we all have a relationship with food. Some are big eaters, some are small eaters. Some like to eat peanuts, some like to eat different things, yeah? But the relationship with food, look for any change there. If your relationship with food is changed, then of course there is something changed. Now, sleep and appetite, if they are disturbed for a day or two, for a week or so, doesn't matter. What makes it to regard it as a positive symptom for depression is the constant nature of it. The constant nature is ongoing. My sleep is disturbed every day. Every night my sleep is disturbed. Every day I'm waking up feeling rubbish. Every time I'm sitting to have my food, I'm just not enjoying it. Even the food which I've always enjoyed, I'm not enjoying it. Just answering a question. No, my friend, it's only the surname I carry. I am not related to Kinza Hashmi, but in case I have not got my genetic testing done to establish whatever it can show, because now these days you can actually find out where your generations have come from. But no, I'm not related. I'm just me, just a psychiatrist, to be very honest. Now, so sleep, appetite, biological functions. What else is biological function? In women, menstrual period. So menstrual period in women is one of the biological functions. If it is disturbed, or it is disturbed in a sense there is a change in it one way or the other, and there is no physical cause for that, it can be indicative of depressive disorder. Now, what else is biological functions? If we are talking about biological systems, we are talking about the intimacy side of it, the physical relationship. Now, we all hold physical relationships with different frequencies at different stages of our life. And there is an element of contentment with it. That are we contented to that element? Now, if there is no change in that aspect of your life, the physical aspect of relationship, and you feel contented, then it's unlikely to suspect depression. And if you remember these 4 biological functions in your mind, most important are sleep and appetite. That will be a good indicator to think about if my sleep, appetite, or other 2 functions as I mentioned, constantly disturbed. That's the most important thing. But before jumping the guns onto depression, there is a whole range of physical health conditions, mainly deficiencies, which present similar to depression. I suggest never jump onto taking depression, antidepressants, or medication for depression without having few physical health investigations. And what are those investigations? Full blood count. Full blood count will give you an idea how your body is operating. Very, very simple prescriptive investigation, available everywhere in the world. If you are anemic, if you have low hemoglobin, you are very likely to feel whole range of symptoms of depression. Get your anemia sorted out, your mood will lift. Mood will go up. You will get better without the need of an antidepressant. So get your full blood count done. Essential. It will tell you if there is any infection, inflammation going on in the body, a niggling thing happening in the background which is putting your mood down. Your mood is low, you are lethargic, energyless, motivation is less, tired, all those things. Anemia can do, low hemoglobin level can do all these things. Trust me. Vitamin B12 deficiency is common. Iron deficiency is common. Our diet has changed over time. We sit longer. We eat unhealthy food. We are not involved in as much exercise, physical exertion, and keeping our system going as we used to. We must look for basic deficiencies in our system first. So full blood count. Find out the reason of anemia. it will tell you. Vitamin B12 test is different. But iron deficiency anemia can be, you can find it, you can make a diagnosis with reasonable confidence on full blood count. Yeah. Then get vitamin D done. If you read on vitamin D deficiency, it will be an eye opener. That vitamin D deficiency can affect your mood, level of energy, even your memory can be affected, even can lead you to confusion states, irritability, you name it, and it causes it. You feel lethargic, tired, energyless, motivationless. There is lack of motivation. Vitamin D tested. Very simple, just supplement it. Yeah. Now, if you are living in a country where the weather is usually cold, then supplementing your diet with vitamin D is almost essential. So full blood count, vitamin D levels, vitamin B12 is common. Yeah. And last but not the least, thyroid. Thyroid profile, thyroxine, made by thyroid glands in our neck. Thyroid, if less in the body, the condition is called hypothyroidism, cause you depression. Total features of depression with hypothyroidism. Then hyperthyroidism, if thyroid or thyroxine increases in the body, cause symptoms of anxiety, similar to anxiety. I'm going to talk about anxiety when we come to that stage. Hence, get the blood investigations done. Full blood count for anemia and for vitamin B12 deficiency. You can get vitamin B12 tested separately as well. For iron deficiency, you can get iron tested separately as well. Vitamin B12 test, vitamin D, thyroid profile, thyroxine levels. These you must get it done. Yeah. So if there is a deficiency of something, get that deficiency sorted out before going on antidepressants, because antidepressants carry side effects. When I'm going to talk about antidepressant as a medication, I'm going to talk about their effects and the side effects, mechanism of action, what is believed they do in human mind. Yeah. So instead of jumping on antidepressants, get these deficiencies out of the way first, because these might be causing you to experience symptoms of depression, which are not going to be fixed by an antidepressant, because you are barking at the wrong tree, which is only going to be fixed by the physical health status, the management of the deficiencies in the body. Now, then what other biological functions? We have sorted it out, set it aside. Now the second set, I'm going to talk about the emotional side. Depression is inherently a disorder of mood. Basically emotions, in simple words. Yeah? So what happens to your emotions? What happens to your emotions? Your emotions, lack of interest, lack of expressing love, lack of affection. You will, instead of a very polite, interesting, simple person who would laugh and joke with friends, become irritable. It's not to happen once or twice, obviously. Of course, even the most sensible people get irritable at times. That's a part of human nature. Anger is normal. I'm going to talk about the normalcy. Anger is normal. And if you are pushed in the corner, leaving no option, you are going to react. That's normal. Happens with everybody. Yeah? So don't take it as if you're an angry person or if you're a non-angry person, that doesn't mean. What happens is, going a bit off my tangent, what happens is your mind gets stuck with options. And the frustration caused by limited options turn into anger. I think when I go through these core mental disorders, I'm going to include anger management and other things. I'm going to keep telling you the different techniques, but I do have a separate slot for DIY psychiatry where I can talk about the techniques. So Wednesday I talk about the core mental disorders, which are basically the essence, which we all need to know, at least the basics of it. Saturday evening, 7 to 8, I put an hour aside, but it takes about an hour and a half because I like to talk. So I have allocated Saturday evening for neurodiversity, attention ADHD and ASD, attention deficit hyperactivity disorder and autistic spectrum disorder. But then Monday evening between 7 to 8, I have allocated it for DIY psychiatry because I can give you some techniques to take home. The session was originally planned for the morning time, but it's better if I do evening because it's convenient for everybody. So I'm going to talk about the emotional side, and then we leave the rest of the depression on my next conversation because I don't want to bore you to death with keeps going on depression. So the emotions, what happens to emotions? Do we feel any change in our emotions? Has our enjoyment level has gone down? Do we feel less motivated, less interested, less excited? Are we losing interest in things which we have always enjoyed to do? Complete loss in everything interesting around us, with everything which we used to enjoy, complete loss. The clinical term used for is anhedonia. Anhedonia is a serious form of depression. I have occasionally come across in situations where individuals feel anhedonic, that complete loss. But what we see is partial loss. They still be functioning, they still be working, they still be making progress, but the interest, the passion, the love, the excitement won't be there, or gradually reducing. Now, lot of times our emotions, as they are not seen by others, if we don't recognize that ourselves, others will only recognize it as our behaviors. So, change in our emotions will affect our behavior. And if you look at the bigger picture, what happens is our mind is unhappy. It is going to affect our emotions, and our emotions are going to affect our behavior. And this is when others will notice things. Now, this is the principle based on cognitive behavioral therapy. This is all CBT is about. There is no magic in CBT. The whole model of CBT is based on what we think affects how we feel and influence our behavior. It's as simple. Now the next week when I further my conversation for depression, because I think it's 8 o'clock now, further my conversation, I'm going to talk about, I've talked about the biological functions, I've talked about the emotional side. Next time, I'm going to talk about what happens in mind, in our behavior, and when it becomes or gets to a stage which require intervention, because we all live within our protective factors as well. Like, for example, if I'm feeling rubbish, and I'm feeling rubbish every day, I might have a friend where I go out with, sit somewhere in a cafe, have a cup of coffee, and use all the words under the sun for somebody in the world, or quite a few people, and take my stress out and come back relatively normal. So we all have supportive mechanisms. So once we understood depression, we talk about what psychological, social, emotional, physical supportive mechanisms are there. I will take you through the process, disorder, understanding of disorder, how we can manage, how we can take steps through different levels of layers, which are protective layers around us. And then we proceed to the choices for medication. Medication is one aspect of it. There are a number of other ways of dealing with depression. Even if we take depression just as one condition, types of depression, and if medication is essential, what other things are available, what other things can help along with medication to pull you out of this stage. So we'll go through everything. How many weeks it will take, I don't know. But at least today I have talked about some introduction, some aspects of depression as the first conversation. We'll take a next step when we meet next week. Yeah. So I think, is there any questions? And do you think we need to bring it to a close, or are there any questions which I can answer before we end the conversation? But I'm really pleased on that, really pleased that you all came and attended the conversation. You can, if you can't, you don't have any questions, please save it for the next time. I love to have an interactive conversation. See you next week. Take care. Bye.